Kangaroo Care Women and Children Hospitals and Fertility Center.
Hello everybody, my name is Dr. Nanditha. I'm a neonatologist and head of neonatal department at Kangaroo Care Hospital, Mysore. Today I'll be talking about Neonatal Intensive Care Unit and why would a baby require neonatal intensive care admission and what are the support that we can offer in NICU. Neonatal Intensive Care Unit is a specialized unit which offers care for newborns who require either medical or surgical support. So neonate means newborns who are less than 28 days of age, and the doctors who look after such babies are called as neonatologists. So most of the babies are born without any problems, but occasionally there are certain babies who might need extra assistance. It could be a medical assistance or surgical. Such babies would need to be treated in this specialized unit called as the NICU. So some of the very common conditions which require an ICU admission would include babies who are born early or born premature, very low birth weight, babies who develop low blood sugars, or babies who have infections, or any other conditions which cannot be treated on the ward and require specialist assistance. Occasionally, some babies are born with what we call as congenital anomalies, meaning when they are being born inside, when they are being formed inside the womb, they can develop problems. For instance, they may have heart defects, they may have problems with the brain, with their spinal cord, or their abdominal organs. So in such cases, even those babies would require management in an ICU. An ICU will be equipped with various machines that a baby would require for its treatment. So babies are usually kept within a plastic box called as the incubator, which keeps the baby warm and also humid. There will be lots of monitors which the baby will be connected to, which will monitor baby's heart rate, its oxygen levels, the breathing pattern and the temperature. Occasionally, babies might require assistance with their breathing, which can be from oxygen to even ventilators. Babies' nutrition will be taken care of by either giving through drips or through tubes going into their stomach. And it's actually quite anxious and emotional time for parents to see their babies in an ICU. However, what I can say is that there are healthcare personnel available 24/7 in the neonatal unit who are specially trained to help these parents. So they would provide counseling to the parents, they would offer any assistance with the baby's care, and also they would ensure that the parental questions are answered, and in order to alleviate any of their anxieties. So parents should not feel unsupported at this very emotional time, and therefore we in the neonatal unit, everybody tries to be as supportive to parents as possible. When can a baby be discharged home safely? So we would say that the babies can be discharged home safely as long as they're feeding well, they're gaining weight, and also maintaining their temperature without any additional heating support. Having said that, we also make sure that the parents' confidence is also up to the mark, so that once they take the baby home, they shouldn't feel that they are not able to look after a very premature baby by themselves. So for this, what we tend to do is, once we feel that the baby no longer requires an ICU care, we discharge the baby to the ward and we offer what we call as rooming in, wherein the baby is being looked after by the parents by themselves, along with some support from the ward staff. And if they have any other concerns, they can get help before they are completely discharged from the hospital. There are certain checklists which have to be ticked, and one such checklist is to make sure that the parents are trained with basic life support. So in case anything happens, anything untoward happens in the house, then the parents will be trained with the basic life support until they bring the baby to the hospital. Should the parents have any concerns or any queries, there'll always be help available, and they can easily speak to any of the healthcare staff. Follow-up of NICU babies. Babies who are discharged from neonatal intensive care need regular follow-up. This is to ensure that they are growing well and also they are developing well in terms of meeting their milestones. Occasionally, because of their prematurity, some babies can develop complications which would need looking into in detail. And depending upon what the baby's requirements are, the baby might need to be followed up by a multidisciplinary team. The time spent in NICU can be quite anxious for parents. However, I would like to reassure them and say that if they have any concerns, they should speak to the doctors and the nurses who are always happy to help them.